Over 65? These 7 medical tests may harm more than help. Here's what to skip and why. Number 1. Unnecessary blood tests in the hospital. It may seem harmless, just a quick blood test when you're admitted. But for older adults, especially those over 65, these routine labs often turn out to be more harmful than helpful. The truth is, many hospitals run standard panels on every patient by default, regardless of symptoms. But according to a 2017 study published in the American Journal of Medicine, over 30% of all blood tests ordered in the first 24 hours of hospitalization were unnecessary. Even more striking, nearly 9 out of 10 patients received at least one test that had no impact on their care. So, what's the danger? It's something doctors call the diagnostic cascade. An unnecessary test might show a slightly abnormal result. Not dangerous, just outside the textbook range. But that single result can lead to more tests, more scans, and sometimes even risky treatments. For example, a mildly elevated white blood cell count, which can happen from dehydration or stress, might be mistaken for an infection. That could trigger unneeded antibiotics, CT scans, or even prolonged hospitalization. Consider Alice, a 74-year-old who came to the ER for mild dizziness. Her labs showed a nonspecific elevation in one marker. Just to be safe, her team ordered a CT scan, which led to a follow-up scan with contrast. Days later, she developed kidney issues, all from chasing a lab result that didn't need chasing. Now, this doesn't mean blood tests are bad. When guided by symptoms, they're essential. But when ordered just in case, they can lead to false alarms, confusion, side effects, and unnecessary costs. Repeated blood draws can even cause hospital-acquired anemia, a real risk for older adults. So what can you do? Ask questions. Speak up. What is this test for? Will the result change my treatment plan? Most doctors will appreciate that you're taking an active role in your own care. In fact, simply asking the right questions can often help you avoid unnecessary tests or treatments that don't truly serve your needs. In medicine, more isn't always better. The best care is careful, measured, and above all, thoughtful. Number 2. PT/PTT coagulation tests. You've probably never heard of this test until a doctor orders it. PT and PTT, short for prothrombin time and partial thromboplastin time, are blood tests that check how well your blood clots. Sounds important, right? But here's what no one tells you. If you're not on blood thinners and you're not scheduled for surgery, this test is usually unnecessary. And worse, in seniors, it can lead to more confusion than clarity. A 2017 study in the American Journal of Medicine reviewed lab practices in hospitalized older adults. They found that 67% of all PT-PTT tests were unnecessary, often ordered as part of routine admission labs without any actual bleeding risk present. That means 2 out of 3 seniors had this test with no medical benefit. And the danger? Abnormal results in otherwise healthy patients often cause delays. Picture this: a mildly elevated PT level, which can happen from age-related changes or even hydration status, raises red flags. Doctors hesitate to perform procedures, consult hematologists, and sometimes prescribe medication, all for a result that may mean nothing. Take James, 69, who visited the ER for a minor fall. He wasn't on any medication that affects clotting, but a PT test was ordered anyway. The result came back slightly high. Suddenly, the care team postponed a needed scan, consulted specialists, and kept him overnight, even though there was no bleeding and no symptoms. His discharge was delayed by 2 full days. So what should you do? If you or a loved one is hospitalized, ask your doctor, why is this test needed? Are we checking for something specific? Many PT-PTT tests are ordered simply out of habit or hospital protocol, not because they're necessary for your condition. And while a single blood test may seem minor, the chain reaction it causes can include extra costs, hospital stays, and emotional stress. There's a common myth that more data always helps. But in medicine, especially for seniors, too much testing can cause more harm than good. If there's no bleeding, no bruising, and no high-risk medication involved, it's okay to pause and question the need. Number 3. Bone Density Scan, DEXA. It sounds like one of the safest tests you can get. No needles, no pain. Just a quick scan to check how strong your bones are. But if you're over 65, especially if you're not falling or breaking bones, the bone density test, also called a DEXA scan, may do more harm than good. Why? Because this scan often finds osteopenia, a mild form of bone thinning that's actually a normal part of aging. But once it shows up on a report, many doctors feel pressured to act, usually by prescribing bisphosphonates, a class of medications that aim to strengthen bones. The problem? In older adults, these drugs often offer very little benefit, but come with serious risks. A 2018 study published in the Journal of the American Geriatrics Society followed over 1,000 women aged 70 and older. The results: medications for mild bone loss reduced fracture risk by less than 1%, while causing a much higher rate of side effects, including esophageal inflammation, severe reflux, and in rare cases, jawbone death. Take Rose, a 72-year-old retired school principal. She had no history of falls, stayed active, and ate well. But her DEXA scan showed slight thinning, and she was prescribed a bisphosphonate. Within weeks, she developed painful acid reflux and jaw pain. She had to stop the medication and took months to recover, all for a scan that didn't reflect any real danger. So when is the test actually helpful? If you've had a fracture, are significantly underweight, or have certain medical conditions, a DEXA scan may still be appropriate. But for most seniors without symptoms, the better approach is prevention through lifestyle. That means vitamin D and calcium-rich foods, like leafy greens, sardines, and dairy. Weight-bearing exercises, walking, resistance bands, light strength training. Balance training, like Tai Chi or yoga. Doctors are trained to act on numbers, but not every low bone score needs treatment. Sometimes doing nothing feels better than the fix. Considering a DEXA scan, ask, what happens if it shows mild bone loss? Are lifestyle changes an option? Sometimes, strength means standing tall on your own. Number 4. PSA test for prostate cancer, men over 70. It's one of the most commonly offered screenings for older men. The PSA test, a simple blood test that measures prostate-specific antigen levels to look for signs of prostate cancer. Sounds smart, right? After all, catching cancer early saves lives. Or does it? The truth is, if you're over 70, the PSA test may cause more harm than good. According to the U.S. Preventive Services Task Force, PSA-based screening is not recommended for men age 70 and older. That's because most prostate cancers at this age are slow-growing, often so slow that they would never cause problems in your lifetime. But once a PSA test comes back high, it can trigger a medical spiral, biopsies, radiation, or surgery, all with serious consequences. Let's break that down. A high PSA doesn't necessarily mean cancer. It can rise from things like an enlarged prostate or even recent activity like biking. But once it's flagged, doctors often feel obligated to investigate. And that's where the trouble begins. Biopsies can cause bleeding and infection. Treatments like surgery or radiation can lead to incontinence, erectile dysfunction, and rectal complications. And what's worse, in most older men, these treatments don't extend life. Dr. Stephen Purcell from Northwestern University puts it plainly: if a man isn't expected to live another 10 to 15 years, screening won't save his life. but the treatment could ruin its quality. Just ask Frank, a 75-year-old retiree who felt great. He had no symptoms, but his doctor ran a PSA test during a routine checkup. The result? Slightly elevated. That triggered a biopsy, which came back inconclusive. Then came an MRI, then a second biopsy, and finally, surgery. The cancer was tiny and non-aggressive, but Frank was left with lifelong side effects, including urinary leakage and loss of sexual function, all from a cancer that might never have hurt him. If you're over 70 and feeling well, think twice about the PSA. Unless you have real symptoms like trouble urinating, blood in your urine, or pelvic pain. Ask, what if it's high? Are the risks of testing and treatment worth it? Number 5. Brain MRI for mild memory, loss forgetfulness. Losing your keys, struggling to remember names. If you're over 65, moments like these can feel scary. The natural worry is this the start of dementia? That fear often leads doctors, or patients themselves, to order a brain MRI. But here's the uncomfortable truth. In most cases of mild memory issues, an MRI does more harm than good. MRIs create highly detailed images of the brain. That sounds reassuring, until you realize that nearly everyone over 65 will show abnormal changes, even when those changes are completely normal for aging. A 2021 study published in Neurology Today reviewed over 3,000 brain MRIs in seniors with mild cognitive complaints. The findings? 86% of scans showed some kind of white matter change, yet only 3% were linked to an actual treatable condition. So, what happens to the other 97%? Many of them fall into what's called a diagnostic spiral. More tests, more specialists, sometimes even spinal taps or brain biopsies, all chasing something that isn't really a problem. And while the doctors keep looking, anxiety grows. Patients begin to self-isolate, stop driving, or assume the worst, even when cognitive screening shows their memory is still within normal range. Let's take George, 73, a retired engineer, sharp and active. But he started forgetting names more often. Nothing dramatic, just occasional slips. His doctor ordered an MRI, just to be sure. The result? White matter spots, age-related and benign. But George didn't hear normal. He heard brain damage. He stopped going to church, gave up his woodworking club, and convinced himself he was fading. All because of a scan that told him nothing helpful. So, what's the better option? Start with a simple cognitive test, a quick check of memory and thinking done in the clinic. If that's normal, and there are no major symptoms like seizures or sudden behavior changes, an MRI usually isn't needed. Ask, is this just normal aging? Zrenya, would the MRI change anything we do? Not every scan shows a problem, and chasing shadows can backfire. Sometimes, the best care is knowing what's normal and living with it. Number 6. Colonoscopy after age 75. It's one of the most recommended cancer screening tests out there, the colonoscopy. For decades, it's been considered a gold standard for catching colon cancer early. But what many people don't realize is that after age 75, this procedure often carries more risk than reward. A colonoscopy involves inserting a long, flexible tube into the colon to look for polyps or cancer. It's thorough, but it's also invasive, requires heavy sedation, and comes with a harsh prep process that can be hard on older adults. And the truth is, once you pass 75, especially if you're healthy and symptom-free, the benefits shrink, while the risks climb dramatically. A large study published in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. The results were eye-opening. For every 1,000 colonoscopies done in adults over 75, only 2 lives were saved, but more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Those complications, they're not minor. They include bowel perforation, excessive bleeding, infection, and adverse reactions to sedation, all of which are more likely in older bodies. Take Dana, a 76-year-old grandmother who had no symptoms and a clean history. Her new doctor urged her to get another just to be safe. The procedure found a tiny polyp, benign. But that night, she developed abdominal pain. At the hospital, they discovered a small tear in her colon. She spent 9 days recovering and hasn't felt quite right since. The worst part, she didn't even need the test. The U.S. Preventive Services Task Force recommends stopping routine colonoscopy at age 75 unless you have symptoms or a strong family history. And even then, other options may be safer. One of the best alternatives, the FIT test, a stool-based screening you can do at home. It's non-invasive, painless, and still catches most concerning cases. If your doctor recommends a colonoscopy after 75, ask, "Do I really need this? Are there safer ways to check for problems?" Because sometimes, the best way to protect your health is knowing when to stop testing, not when to start. Number 7. Full-body CT scans for peace of mind. It sounds like the ultimate checkup. A full-body CT scan, marketed as a high-tech way to catch cancer and disease before they start. You lie down, the machine scans you from head to toe, and in minutes, you walk away thinking you've done the right thing. But here's the hidden truth. These scans may actually put your health at risk, not protected. Full-body CT scans are often sold as part of executive wellness packages or private senior checkups. But most major medical organizations, including the American College of Radiology, strongly warn against using them for routine screening. Why? Because the risks far outweigh the benefits, especially for older adults. For starters, these scans expose you to a high dose of radiation, often the equivalent of hundreds of chest X-rays in a single session. That's a real concern, according to a 2023 study published in JAMA Internal Medicine. The rising use of CT scans in the U.S. may now account for up to 5% of all cancer cases nationwide. But radiation is just the beginning. These scans also uncover tiny, harmless findings, small nodules, cysts, or calcifications that are part of normal aging. But once seen, they're hard to ignore. Doctors order biopsies, follow-up scans, even surgery, all to investigate something that might never have hurt you in the first place. Take Marcus, an 80-year-old retired martial arts instructor. Fit, active, no complaints. He signed up for a full-body scan as part of a senior elite checkup. The scan found a tiny lung nodule, just 3 millimeters. It was likely nothing, but protocol kicked in. PET scan, lung biopsy, and days later, a collapsed lung. 2 months of recovery for a benign finding that never needed treatment. So what should you do instead? If you have real symptoms, like a lingering cough, weight loss, or blood in your stool or urine, targeted scans can help. But full-body scans, just to be safe, that's like hunting a needle in a haystack with a flamethrower. You might find something, but at what cost?